You got your bone density results and they were lower than you expected. Maybe your doctor said osteopenia. Maybe osteoporosis was mentioned. Or maybe you just saw the number on the report and thought, okay, what does this actually mean for me? First, don't panic, okay? But also, don't ignore it. Low bone density is something to take seriously because if nothing changes, bone loss can continue as you age. And over time, that can make bones more fragile and increase the risk of fractures. But that report is not the end of the line. There are things you can do to help slow bone loss, support stronger bones, and in many cases, improve bone density over time. And if you're also noticing that what used to work for your body is no longer working, I host a free monthly midlife reset training called Why What Used to Work Isn't Working Now. The registration link is in the description below, so go check it out and make sure you sign up for my next one. Now, let's talk about what I would actually do if I got a low bone density report. The first thing I would do is make sure I understand what the report is actually telling me. A DEXA scan usually gives you something called a T-score. A normal score differs from osteopenia, and osteopenia differs from osteoporosis. So before you start spiraling or Googling yourself into a panic, ask your doctor, where am I on this scale? And what does this mean for my risk? Because you need clarity before you make decisions. The next thing I would do is look at strength training. And I don't mean random little weights here and there. I mean a structured strength plan that challenges your body safely over time. Bones respond to stress, not emotional stress. We have enough of that already. I mean the healthy kind of stress that comes from lifting, pushing, pulling, carrying, and making your muscles work. Walking is great. Please keep walking. But walking alone is usually not enough if your goal is to build or maintain bone density. Weight-bearing exercise and resistance training are both important for improving bone density and helping prevent osteoporosis. The next thing I would look at is nutrition, because your bones need building blocks. That means enough protein, calcium, vitamin D, and not constantly under-eating because you're trying to lose weight. Calcium and vitamin D matter for bone health, but they are not magic by themselves. They work best as part of the bigger picture. Strength training, enough food, enough protein, and working with your doctor when medication is appropriate. This is where so many women get frustrated though. They're told, take calcium, but nobody walks them through the full plan. And that's why my free monthly midlife reset training walks you through why your body changes in midlife and what actually deserves your attention first. The registration is in the description below, so go check it out and make sure you register for my next free live training. The next thing I would do is stop expecting to change overnight. Your bone density didn't get lower overnight, so you can't expect to build muscle and improve bone density overnight either. This all takes time, consistency over months and years. But that's also the encouraging part, because you don't need to panic and overhaul your entire life by Monday. You need to start by doing the right things consistently. One of my clients came to me because she knew her health was headed in a direction she didn't like. She started strength training consistently, worked on her nutrition, and over time she became stronger, more confident, and more capable in her everyday life. That's the point. Not panic or perfection, but a clear plan. So if your doctor told you your bone density is lower than expected, here's the takeaway. Don't ignore it or assume it's hopeless. And don't rely on a single supplement or quick fix to solve the whole problem. Start with strength training, support your body with enough food, protein, calcium, and vitamin D, and talk with your doctor about your actual risk and whether medication makes sense for your situation. And lastly, stay consistent long enough for your body to respond. This is exactly why I host my free midlife reset training every month, because so many women are trying to figure out why their bodies are changing, why old strategies are not working anymore, and what they should actually be focusing on. You can check out the registration link below to find out when the next free training is, and make sure to sign up. Now, if this video helped you, make sure to go watch this video next. Feeling weaker after 40? Here's what's actually happening. Because if your bone density is changing, your muscle strength matters too. And in that video, I explain why so many women start feeling weaker after 40 and what to do about it.